Hantavirus, it's a virus that was discovered during the Korean War.
So how is it transmitted?
So it is transmitted primarily from rodent to human.
Are we on the road to a new pandemic, do you think?
Not with hantavirus, no. So I really do not think so. What is unusual about this?
Hello, I'm Tom, the voice of Aranet, here with the new Air Matters session. Today I have the pleasure of welcoming Dr. Sanjaya Senanayake, and I will take a little bit of break from my script and say a quick shout out and a great big thank you to Allison and Alejandro Rivera for having made this connection when we were in Canberra together and had a wonderful Thanksgiving dinner. So thank you to Alex and Allison for making this connection. So Sanjay is an infectious diseases physician and director of hospital in the home at Canberra Hospital. He's also a lecturer at the Australian National University Medical School, also a conjoint lecturer at the School of Public Health and Community Medicine, University of New South Wales, and just to round it out, he's a screenwriter and novelist.
Oh,
okay. So I'll take a deep breath and start in. Sanjaya, we've all read, heard, and seen the news about hantavirus outbreak on the cruise ship MV Hondias. In fact, yesterday it just made port in Tenerife, and the authorities are starting an evacuation process. Will you share? We will share some reputable news sources about this when we share the video. Can you please maybe start by explaining what hantavirus is?
Sure. So hantavirus, it's a virus that was discovered during the Korean War. And it was during the Korean War that a number of, about, I think 3,000 from memory, UN soldiers got sick with this unusual infection. And they determined that it was a virus that was transmitted from rodents to humans through their secretions, so feces, saliva, urine. And as you can imagine, the war setting, rodents and humans are often getting into close contact with each other far more than you would normally see. And this was associated with someone asked me today, and I need to ask a Korean person this, it's either the Hantan River or the Hantan River. So on the basis of that, it's either hantavirus or hantavirus, but it got that name. And the syndrome that you were seeing in that part of the world was kidney failure and hemorrhage. But fast forward about 35, 40 years later to the United States, to the Four Corners, where 4 states meet, which you're probably familiar with, Tom. So I think it's Utah, Colorado, Arizona, New Mexico.
Mexico, yeah.
Well, yeah. Suddenly, in 1993, in that area, Navajo indigenous people started getting this horrible infection where they had fevers and then difficulty breathing. And eventually they discovered that it was due to hantavirus. But this hantavirus wasn't causing the same clinical illness that we were seeing in Korea. We were seeing this new syndrome where you were primarily getting a problem with the lungs. And over the next 30 years, that type of hantavirus infection was found in different parts of the Americas. So it's well and truly established in South America. And of course, we're associating this particular outbreak with the Andes strain of the virus.
You brought up something that's very interesting to me because I've already started seeing misinformation about this starting to float around. And one of those is somebody dragged up a patent application for a vaccine that had been started in development by the United States Army in the 1970s. And people are dragging this up and saying, look, they knew about this and they were trying to prepare by having this vaccine and they were going to use it as a weapon. So there's already misinformation about something that probably very few of us had heard about maybe a month ago. So it's so quick.
No, that's quite right. And even in my field, because it's not an infection that is found in Australia, as an infectious diseases specialist, I know what it is. I know what to look for, but I still haven't seen a case. I haven't treated anyone with it. I've seen someone where we suspected it and we've tested a few times, but we've never never found it. So even in my field, it's not something we have much contact with at all. And other specialists in my field and primary practitioners, general practitioners, they wouldn't have heard of Hantavirus until now in our part of the world.
But it's really good. I think it's really good we have a conversation like this because we can kind of cut it off at the pass, get rid of some misinformation, really. So you mentioned it's not in Australia. I know that there's the Andes variant, Argentina. How prevalent is this internationally?
So it's in certain pockets in the world. So I guess if you call the original one, the hemorrhagic fever with the kidney syndrome, the Korean one, if you look at that syndrome, you find that in the old world. So in pockets of Asia, in parts of Europe, I believe Latvia has it. I believe it is found here in Latvia. Yes,
Okay,
they're in Latvia. So
we'll
yes,
check.
obviously listeners can correct me if I'm wrong, but I believe so. And certainly in Scandinavia, it is found. But it's the Americas where you find the separate hantavirus, which causes this lung syndrome.
I've read a bunch of different things about how the virus is transmitted and specifically about different variants and maybe slightly different transmission modes. So how is it transmitted?
So it is transmitted primarily from rodent to human. So humans who are exposed to infected rodent secretions, feces, urine, saliva, that gets aerosolized and inhaled. That's how people tend to get sick with it. Of course, as we know, and it's been highlighted with this outbreak many, many, many times, with one particular strain of the virus, the Andes virus, you can occasionally get some person-to-person transmission, but it's primarily a zoonosis, an infection that jumps from animals to human. And if you put that into context, Tom, in the last 50 years, we've probably had about 50 new infections appear in the world, and about 3/4 of them are what we call zoonoses. So infections that jump from animals to humans, and hantavirus is no exception to that.
It's funny because I remember when I was studying biochemistry, we were told very specifically about how difficult this is. I mean, how difficult it is to get cross-species transmission to occur. So yeah, it is something. But do you think it's something that's novel in our world today that we're seeing more?
I think it's most likely reflects the fact that we've got this burgeoning human population. There are 8 billion of us, and I think we've arrived at that figure fairly quickly. And with that larger number, we need larger amounts of land on which to live, and we therefore are encroaching on habitats of wild animals. And what that is allowing is, closer than ever before in history, the interaction of humans, wild animals, and domesticated animals. And that allows the transmission of these novel pathogens from one species to another.
Yeah. And that's exactly what we see in Latvia. I mean, I think I remember reading about the same thing in Australia, where we see things going from wild swine to domesticated swine, and we end up culling incredibly big herds of pigs from farms. Are there any similarities between respiratory viruses like COVID-19, flu, and the cold and hantavirus?
Similarities in the sense that at their extreme, they can all make you very sick to the point that you may need assistance breathing. And hantavirus, if you get it, tends to be more severe than these, in the sense that, depending on the studies you look at, up to about 40% of people can pass away. So it can be very, very serious.
Yep. So given all of that, is there any value in making sure that you're in a well-ventilated area?
So in Latvia, you are thankfully emerging into the warmer spring and summer, so that nice warm weather.
You're on your way down.
Where That's right.
Yeah.
So, in fact, in Canberra, where I'm from, it's just started to get cold, and yeah, look, we know that in winter we see a lot more transmission of respiratory infections, and part of that is because people don't want to be outside in the vast outdoors and be miles away from each other and in the well ventilated outdoor areas. No, we all hover together inside in the warm air conditioned rooms, and that helps transmission of various respiratory pathogens. So yes, having well ventilated areas is always a good way to reduce the chance of respiratory transmission of a number of infections.
So, given all this, so the big question is right now, are we on the road to a new pandemic, do you think?
Not with hantavirus, no. So I really do not think so. What is unusual about this, and I never thought even though I knew about hantaviruses, I read the book that an author put out about the 1993 Four Corners outbreak. And at the time and subsequently, I thought, look, this is something, it's very niche, it's in my field, no one would ever hear about it. To think that we'd be now talking, me in Australia, you in Latvia, about an outbreak on a cruise ship from Argentina is something I could never have fathomed. So this is something unusual. And what is unusual is that the hantavirus outbreak happened on a cruise ship with people of different nationalities who are now trying to be repatriated to different parts of the world. And in each country, their media is very invested and interested in finding out what's happening. So there's a lot of talk. So there's a media pandemic about this outbreak. But in terms of, is this going to be like COVID in 2020 from a cruise ship? I don't believe so. Two important differences, Tom. Unlike COVID was novel, we didn't know anything about it. It was a new infection in 2020. Hantaviruses we've known about for many decades. We know its behavior, and we also know that with person-to-person transmission with the Andes virus, it's very limited and requires close contact. So unless the virus has dramatically mutated, we won't see a pandemic. But of course, that's why we do these outbreak investigations, to see a number of variables and factors, including whether the pathogen has mutated and changed its behavior.
So the next question I have is actually a fairly delicate one, because especially as an American, I mean, given the geopolitical situation, are we well enough prepared for these situations?
COVID really helped prepare us for a pandemic. I think before COVID, we weren't. We weren't that well prepared. Every country, including Australia, we did our pandemic flu exercises, but no one particularly high up, I feel, took them that seriously because of the fact that the last pandemic prior to that had been 100 years earlier. And there were always other priorities in a busy public health system wherever you are, wherever you were in the world. But since the pandemic, since we've seen the rise, and you touched on it earlier, Tom, about misinformation, and we've realized the importance of combating it and the difficulties in combating it in this world of social media. And we have seen vaccine diplomacy, vaccine nationalism. We've seen such complex geopolitical interactions during those early stages of COVID. I think all countries, or many countries, have reflected on their response to COVID and reflected with each other on how we could have done things better. And we are definitely better prepared than we were before. Does that mean it's still perfect? No, it's not. But these are all practice runs, and we get better and better at how to deal with them. And certainly, I think a hantavirus outbreak on a cruise ship is one we didn't anticipate. So it's another one we can cross off the checklist.
That's a very optimistic answer. But so specifically from your perspective, is there anything more that like Australia or other countries could do to be prepared for this?
Australia did a couple of important things. If you go back to COVID, we've recently, on the last year or so, had 3 of my colleagues look at COVID, our response as a country. And the COVID response inquiry is really useful. It gets into the guts of the matter. It looks at what we could have done better and what we need to do in the future. And a lot of countries are doing that introspective reflection and have got reviews and recommendations out of that, how they need to address the next pandemic according to their existing infrastructure and resources. So we each have to do that. The other important thing we did in Australia is that in January this year, we have our first CDC, the Australian Centre for Disease Control. We wanted to call it the ACDC.
That would have been so perfect.
It would have been, but I believe they're thinking of doing that. But then a copyright came up with a certain heavy metal band. So that didn't happen. But we have been advocating for a long time that for communicable diseases, for coordinating outbreaks in a federation of states and territories like Australia, ideally we do need a CDC to be at the forefront. And in fact, with this Hantavirus outbreak, I believe today our health minister, the National Health Minister, has talked about how there would be a single strategy for all the repatriated passengers coming back from the cruise ship, irrespective of which state or territory within Australia they will go. And I believe that the CDC will be an important part of that. So having, and a lot of countries are like Australia. The US, of course, has its own CDC and a federation of 50 states. Neighbouring Canada, a very large country with differing provinces as well. So a lot of countries are like this, and we need to make sure that we're all talking, we're all on the same page when these things happen. We want it to be like an automatic response in terms of many of the things that we do, rather than arguing and debating at the time, which slows and does not optimize the response. So I think those are 2 very important things we can do at a national level. And of course, Tom, look, a lot of these outbreaks, as with this cruise ship, crosses borders very quickly these days. That's because it is so easy for you or I to get on a plane and travel to the other end of the world in a relatively short period of time. So I think over 1 billion people traverse international borders every year. And they can do so within the incubation period of an infection. So it is very easy for an infection to cross borders because of that. And for that reason, it's really important that countries are in touch with each other and have surveillance systems where they can transmit information about infections in a timely manner.
I won't say specifically what kind of bothered me about our local community and the response to COVID, but is there something that we should be encouraging leadership in local communities to be doing?
That's a very good question. Do you mean during an outbreak or?
In preparation, I'd say.
In preparation. Look, I think one of the big things and one of the big issues we're seeing in the background, or now not so much in the background, but more in the forefront, is vaccine misinformation. And many of these infections that we are starting to see a resurgence of, so measles, etc., worldwide, because of vaccine hesitancy, because of vaccine misinformation. So I think at that very basic level, if we can educate and encourage people to vaccinate, I think that would be very important. So that's really at the grassroots level that we can start to achieve those things. And I think vaccination is the biggest victim of its own success. I mean, vaccines haven't been around for that long, but they've done such a good job at making us forget what certain infections are like, how horrible they can be. To see a child suffering with tetanus or diphtheria, or someone paralyzed because of polio, because we don't see these things anymore, we forget how wonderful vaccines have been. So because of that, we really need to make sure that we try and promote vaccines as much as possible. But what is also important, and what came out of our COVID response inquiry, and probably others as well, is that it's really important to be upfront and honest with the public. And during an outbreak, tell them these are the uncertainties. These are the things we don't know. We think this is right on the basis of this and that and data that has shown this in the past, but we don't necessarily know, and we're asking you to trust us. So I think that is really important, because of that loss of trust was one of the big issues we saw with COVID. So engendering trust through through transparency at a community level, encouraging vaccination, those sorts of things are very important. Specifically for hantavirus, for leptospirosis, which is another rodent-borne infection, making sure that you control rodent populations, infestations in cities and in rural areas as well. Those things are also very important, so there isn't an outbreak in the first place. And
we're very lucky in that we have 4 cats, and so every morning they show us what they've been doing outside. So they do that for us. Well, you talked about some very important things, of course. I think that I remember during COVID, especially at the beginning, and I had the feeling that people like Anthony Fauci, et cetera, they were telling us what they did know, but they were hedging what they didn't know. And it felt, and that sort of came out later when changed recommendations about social distancing, masks, et cetera, from the CDC in the United States. And yeah, I really like what you said. I think it's so important that we just be upfront and honest about what we don't know. It's almost as important as what we do know.
no, look, I completely agree. And during COVID, I was fortunate enough to be involved in the media as one of the experts who was asked about the pandemic as it evolved. And I can tell you, Tom, there are a lot of times I didn't know, and I was never afraid to say that. Look, I just don't know. Let's see what the evidence shows, but this is what I believe on the basis of this and that. And I don't think you can go wrong by being honest with the public. Public are very educated, and particularly now they know what the New England Journal of Medicine is, the Lancet, and all these things after COVID. They randomized controlled trials, terms which they may not have been familiar with before 2020. They certainly are familiar with now.
Yeah. And yeah, certainly those are things that we bring up. So just to summarize, so hantavirus is not really something that we should be concerned about very much right now for ourselves as individuals, that it's kind of in the background. We should trust and hope that authorities are doing what they can to make sure that the people who were on the ship or who have been exposed are helped, and that we keep track of what's happening. And that we should also, from national and community level, be making sure that we're encouraging people to find real information, seeing and sort of correcting misinformation, and encouraging vaccination as much as we can. Is that a reasonable summary?
That's a very reasonable one. And guess another thing that you can do as an individual in the community is let someone know that you're sick. Don't, actually simple things we talked about during COVID. If you're sick, don't go to work. If you're sick, go and get tested. There's in Australia, for every case, now Salmonella and Campylobacter, I'm sure you're familiar with, they're disease infections that cause diarrhea, gastroenteritis and diarrhea. In Australia, for every case that is discovered by a positive poo sample that someone submits to the lab because they went to see their doctor with diarrhea and the doctor arranged a test, for every one person that's discovered, depending on whether it's Salmonella or Campylobacter, there are 7 to 10 people where it hasn't been discovered. Okay. So there are people in the community who just put up with it and carry on, potentially infecting other people as well. So if you are, significantly sick, there is no harm in seeing your doctor. And I don't know about Latvia, but these days also in Australia, we can do telehealth consultations. So you don't even have to go to the doctors, and they can assess if you need a test at the pathology collection centre or not. So that's another thing I would think about. And I was going to say something about hantavirus. Yes, the other thing I was going to say about hantavirus was this. At the moment, there is no specific treatment for hantavirus, whether it's the renal syndrome, which you see in the other parts of the world, or the pulmonary syndrome you see in the Americas. So there's no antiviral that you can give. The treatment is very much supportive. And I should add, I think we were going to talk about symptoms at one point.
Yeah, please.
Yeah. And for both syndromes, you start by getting a flu-like illness where you can get fevers, muscle aches, maybe some diarrhea. And with the one in the Americas, you can get the lungs getting filled with infection and making it difficult to breathe. And in the other one, in the other parts of the world, you can get the kidney problems and the bleeding. Unfortunately, the one which affects the breathing, which is the one we're talking about now on the cruise ship, tends to be a more aggressive disease than the one in the other parts of the world that affects the kidneys. But in both cases, there's no great antiviral that works against them, and the treatment is what we call supportive. So if your oxygen levels are low, we give supplemental oxygen to you to bring the levels up, or if your blood pressure is low, we give you fluids or medicines to bring your blood pressure up till the infection runs its course. But one thing we found during the Ebola outbreak in West Africa about 10 years ago now, how time flies. Yeah. But do you remember that, Tom?
I do very much so, yeah.
Yeah. Ebola had been around for about 40 odd years at that stage, and there wasn't an effective vaccine. There weren't effective treatments, but very soon after that outbreak, which affected a number of people in the world and scared everyone in the world and health departments and governments in the world, we suddenly had vaccines and treatments.
Right, yeah.
And I wouldn't be surprised if after this hantavirus outbreak, we do see a rapid progression in technology in terms of diagnostics and therapeutics, which would be a good thing for something which is not rare, but not common, but certainly seen every year in many parts of the world.
It's so true. Necessity is the mother of invention. Absolutely. But another good thing that has happened, of course, as we start seeing these diseases more and more, the technology around creating the vaccines has become so focused and so good. And I won't mention the one that people are afraid of, but we do, you see that. So I remember when I was studying biochemistry, little of this technology existed 30 years ago. But now our ability to come to speed with things is amazing to me. It really is amazing.
Absolutely. I still scratch my head when I think about January. Now, the first Australian case of COVID was January 25th, I think it was, January 25th, 2020. And by the end of that year, they were vaccinating the first people in the UK.
Right.
And I was just thinking, wow, that's amazing that we have the technology to do that. And the vaccine technology is advancing, and we're seeing vaccine technology such as mRNA vaccines just progressing to be used for other infections as well. So hopefully that trajectory will continue, Tom.
I'll bring you to mandatory vaccination in 1775. And probably you know this, that George Washington's troops, who were fighting against our common colonizers, were pulled away from the battlefield, and Washington insisted that all of his soldiers be vaccinated against smallpox because it was devastating his troops even before they could get to battle. So the first, in the United States at least, the first instance of mandatory vaccination, 1775, by the father of our country, George Washington.
There you go. Another feather to add to his cap, eh?
Right. So
Yeah.
thanks so much, Sanjay, for taking the time from your holiday. You'll probably see us again soon because Alejandro will not tell me his empanada recipe unless I come to Canberra. So we will probably see you again soon, which would be a wonderful thing to do.
Oh, it would be lovely to see you both again. And this was
Okay,
also an unexpected surprise and delight. So I was
great.
so happy I could help assist with this podcast.
Thanks, and we'll send you a link very soon.
Oh, please do. Thank you so much.
Thanks. Bye, Sanjay.
Bye.